Hi everyone, this is a short 15-minute lecture chat about conceptual and scientific frameworks applied to population-focused nursing, which is public health nursing. And this is Chapter 9 in your textbook, and this will help you with your future assignment about the model in 650 that is about health behavior or health and education. And so it starts off with talking about the wheel, and you've been looking at the wheel now for a couple of weeks because I've asked you to take a look at it for documenting on your log. And so in this circle there's 17 interventions, things such as advocacy, social marketing, policy development and enforcement, and in the blue areas, health teaching, counseling, and consultation, and of course the other 11 or so that I want you to become familiar with. Hopefully in your 2 semesters you will be able to try all of these actions or interventions, but depending on your organization you may not be able to. But I do want you to think about the values that public health nursing has, and we're going to talk about them in a minute. So on this wheel we have 3 levels of practice: the community level, the systems level, and then the individual or family level. And so again, that's some of the things I want you to get used to thinking about as well as we go through our practice, because bachelor degree level practice is really the individual level. Some of you might have administrative experience, and that's systems level, but typically the bachelor nurse is at the individual level. So some assumptions about the wheel, and remember, assumptions are the things that we assume to be true. We don't really have any proof about it, but we go along with it. And so I do agree with all of these 10 assumptions that they have about the wheel. Number 1, public health nurses' interventions are to promote health and prevent disease for populations. We are thinking of our client as the population, and we are promoting health and preventing disease in our actions. Number 2, we focus on the population. Again, the population is that group of people under our care. Could be a geographic location. That is why there are our population. It could be a culture or ethnic background that they have in common. It could be a group of students, a parish church. It could be a factory. Whoever we are responsible for is our population, depending on, and then they have certain characteristics that they have in common. Number 3, we focus on what determines health. The determinants of health, and this is a concept that I really want you to understand, and I'm going to give you a video to watch on the determinants of health, because it's what we feel determines health in our populations. And those are things such as the biological factors, such as a tendency towards high cholesterol, our age, menopause, things like that. Also, the determinants are socio-demographic factors, whether you're working, whether you are highly educated or poorly educated and literate, what your income is, and those factors about a person. And then next is environment, where a person lives. If you live in a highly polluted city or a highly crowded city, that will determine things about your health, your anxiety, your pollution, things like that. And then the last one are the personal habits. And this is where we really have a big impact, where we feel that nurses can really have that impact of promote health and prevent disease. Because smoking cessation programs, exercise, diet, those factors, when a person has diabetes, that personal habits of checking your feet and things like that. So we really, as nurses, public health nurses, focus on those behavioral, personal habits that we can change. So I want you to be thinking about those as well when you are out in the community. What approaches can you use to change? What habits need to be changed about people in your community? Number 4, Priorities are set after doing a community assessment. And again, that's why I'm pushing you to get that community assessment done early, because you have to understand who your community is, what they're made up of, who they're made up of, what services are available, because then you can set your priorities. And again, public health money is very limited, and so public health nurses need to be smart about how their money is spent in the limited supply that they have. And so determining who needs what will be the most effective way to then begin the planning. The fifth assumption, the focus is on prevention. And again, we have the 3 levels of prevention, and we talked a little bit about the 3 levels of prevention. Primary prevention, nobody has the disease. We are trying to prevent the disease in a person. We are educating them to stay healthy. These are typically healthy people, and we are educating them. It also includes vaccination. Because they are not sick, we are giving them the vaccination to keep them well, to prevent any diseases. And so that's primary level of prevention actions. Secondary level of prevention actions by the public health nurse are screening and then sending for treatment, referring. Remember, screenings are not diagnostic. They are looking for disease. We're looking to find it when it's been hidden, and get a person to a physician or a nurse practitioner in order for them to get treatment before, sometimes before symptoms are even seen. As we know with the silent killer, hypertension, we're looking for high blood pressure in people who wouldn't know that they have it. So secondary is screening and treating, teaching them about medications if they are diagnosed by their healthcare provider. And then tertiary, we know these people have a disease in tertiary. We know the group of diabetic women. We know the group of people with hypertension. We know the children with asthma. And now we are trying to prevent problems that may develop from this disease in the long run. So we are either rehabbing them to get them back to their highest level of functioning, or we are doing actions. It could be education, it could be monitoring, and activities and exercise and things like that. So in tertiary, we know the person, we know the people in the group have the disease, and we are trying to prevent disability from that disease. Number 6, we intervene at 3 levels of practice. So first we had 3 levels of action, and now we have 3 levels in our practice, and we can intervene at the community level, and I'm going to go over these in a few slides. We can intervene at the systems level, or we can intervene at that individual family level. Number 7, we use the nursing process, which is assess, plan, implement, evaluate. You've learned this. All nurses use this. We're using this to assess our community, plan for our community, implement our program in our community, and then evaluate our community. Number 8, we use the wheel because their interventions then can be used at those 3 levels of practice. Number 9, public health nurses do some of the 10 essential services and enhance those 10 essential services of public health that we went over in Chapter 1. Number 10, we are grounded in focusing on the entire population. Of course, we focus a lot on the most vulnerable, but everyone in our population is under our care. We focus on the greater good for the people, again, because we do have limited resources available to public health. We focus on the greater good. We focus on social justice issues. We focus on equity. We focus on epidemiology as our science and nursing as our science, and then independent action. And I hope you've thought about this, but nurses in the community have a lot of ability to do independent action, which is under our Nurse Practice Act. We're not going outside of our Nurse Practice Act, but we are working independently in the home. If I'm doing a home visit as a home care nurse, I am taking independent action to assess that client and report as needed, or to educate as needed. So again, the wheel is our model of public health nursing. It's our model that is very comfortable and very thorough in highlighting our practice. Okay, so here again it is. I want you to focus on page 196 to look at what the colors mean, why they are grouped this way, and again look at the inner circle where it talks about population-based, community-focused, and systems-focused actions of your interventions. I want you to look at Table 9 to understand the different levels, again, the system level, the community level, and the individual level, and our actions or our process. So again, you're going to identify the population of interest, establish a relationship, assess priorities, elicit perceptions from those around you, set goals and write objectives, select program interventions, consider evaluation methods, implement the program, adjust as needed, evaluate. Report to your supervisor, your funder, your grantor, and others, and then disseminate information so that others can learn from you. Make posters at conferences, which you will do next semester, and promote your work. So really those can be applied at the systems level, at the community level, and at the individual level. So I want you to look at Table 9.2, which is on pages 201 to 205. And again, this goes into some beautiful examples of the interventions, the 17 interventions from the wheel, and examples of how nurses work at the systems level, the community level, and at the individual level. Now I have a link here. If you download these slides in Canvas and click on those links, there's going to be some articles and some websites for you to visit to understand systems level change, individual level change, and community level change. So here we have at the community level change, you're going to understand how humans react to change, be willing to work with others, use a variety of approaches, develop skills in your community members to help you, provide support and information, and change policies and change barriers. At the individual level change, you're going to use the models and theories that have already been developed, such as the health belief model, the socio-ecological model, and look at the syllabus for the others as you choose which one you're going to focus on. See which one fits best with the way you practice and how you will practice in the community. The trans-theoretical model at the bottom, this will take you to that explanation, and the way that works is that there's this continuum of people don't understand anything, then they learn a little bit and they think, well, I'll think more about it, and then they think about, I think I could make that change, and then maybe they fall off and they go, oh, that change is too hard, and they go back and you try to convince them. So at any point in the trans-theoretical model, you are trying to encourage them to change their behaviors. And again, that is where we have our most effective programs. So thank you very much. That is all. And please check Canvas because there will be a discussion board this week, and there'll be more readings for you. Have a good week.